In today's video, I'll be talking about everything you should know before going for HSG test. So, in this video, I'm going to teach you everything you should know. The first one is the purpose. What is the purpose of going for SSG test? It's primarily to evaluate the shape and structure of your uterus and the fallopian tubes. They give you this test to evaluate whether the fallopian tubes are patent or the shape of your uterus. They are used to investigate infertility and recurrent miscarriages. Procedure. How this is done is that a dye is being injected into your uterus through the cervix, and the x-rays are taken to visualize your uterine cavity and the fallopian tubes. So they collect a long syringe type of instrument, collect a dye, inject it from the vagina through the cervix into your uterus to check whether there is an abnormality in your uterus and in your fallopian tubes. As you can see, the results will come out in an x-ray. If there is a blockage, it will be indicated on the x-ray. This test is normally given to women suffering from infertility to rule out whether their fallopian tubes are patent. So in this video, you will learn a lot about this procedure. Then preparation. How do you prepare? You have to follow all the guidelines your radiographer will be giving to you and your healthcare provider. This might include taking pain medication before the procedure or avoiding intercourse or certain medications in days leading up to the test. They have to tell you what you should do and not to do before the test. The next one is the timing. What are the timing for this test? Schedule the test during the early follicular phase of your menstrual cycle, that is 5 to 12 days after your menses. This is to avoid interference with conception, to avoid interference with ovulation and conception. That is the reason why you are given 5 to 12 days after your menstrual cycle. Another one is pain and discomfort. Be prepared to have some discomfort in this test. The test is slightly painful for some women. Why it's very painful for some women, why it's not painful for some. So many women experience cramping similar to menstrual cramps when the dye is injected into your uterus. So you have to be prepared. Then the side effects. What are the side effects of this test? You should understand the potential side effects, such as you have a little spotting after the procedure. You will have cramping similar to your menses or lightheadedness. You get. So these usually subside shortly after the procedure. That's why we encourage patients or clients to rest after this procedure. Then what should you expect after this procedure? You expect an infection if the instruments are not sterilized properly. Another thing you should expect after this procedure is itching and swelling. Then fainting during or after this test. Then iodine allergy for people that have allergy to iodine. Then in the case of infection, antibiotics is given. Then result. Discuss with your health provider when you can expect to receive your result. They will have to interpret the images because it's not something a layman can interpret. It is only the healthcare providers that can be able to interpret those results. So you always work with your healthcare provider to interpret your results and give you accurate results. Then follow up. How do you follow up? Depending on your result, further tests or treatments may be recommended. Assuming that you have a fluid in your fallopian tube that can be suggestive to an infection, they have to place you on a proper antibiotic regimen. So that is why you have to go through your healthcare provider to interpret and follow up those tests you have done. Emotional preparation. You have you are undergoing test for infertility reasons. So prepare yourself emotionally for the result. Anything can be seen on the result. You might have a patent tube, you might have blocked tubes. So it's natural to feel anxious. But remember, the test is a way forward towards your fertility health to get better. So what else? Support. Consider having a friend or family member that can accompany you and help you to support you emotionally or drive you home if needed. Because remember all the side effects I have mentioned. So you need someone around you to support and be there for you in time of this special need. At least drive you home after the procedure. By knowing these things before an SSG, you can prepare better for yourself physically and emotionally. So prepare yourself before going for this test. So if there is anything that you have experienced in this HSG test and you have gone for this test, kindly note in the comment section. Tell us your experience for others to learn. Thank you.